Hi, my name is Dr. Gabby Poole, and I serve as the Physician Assistant Program Director here at CSU. I'm also a physician assistant by background. And the myth that I'm here to talk about today is, why can't we use antibody tests to prove immunity? Antibodies from having the virus last much longer than the vaccine. False. There is a lot of information out there about antibody tests. A positive result on an antibody test suggests that you had COVID-19 at some point in the recent past, even if you did not show any symptoms. A negative test result suggests that you have not had a recent COVID-19 infection. However, it does not prove that there has been no prior or current infection. Antibodies can be present at levels below the test threshold for detection. It can take 1 to 3 weeks after an infection for antibodies to be detectable. In fact, a vaccinated person who has not previously been infected is highly likely to get a negative result if an antibody test is performed, because different serology tests detect antibodies to various parts of the virus. Some tests detect antibodies to the spike protein of the virus, which are produced in response to viral infection or the vaccine. Others detect antibodies to the nucleocapsid protein, which are produced in response to infection, but not by current vaccines. Since the vaccines specifically train the body to identify the spike protein of the virus, you could potentially be getting an antibody test that is checking for antibodies that you just do not have because you were not previously infected. Because of this, antibody tests are not a good measurement for immunity. Immunity from natural infection is also highly variable. Several studies have shown that a decent percentage of infected people may not produce detectable levels of antibodies. This is because not all infections are the same. The variability of people's infections and immune responses make it impossible to find a standard of lasting protection. Vaccines are much more standardized from their dosage to the intended outcome. Even if some people mount weaker immune responses to the vaccine, the overall risk of severe outcomes like hospitalization, long-term COVID symptoms, or death are dramatically reduced by vaccines. Vaccine-induced immunity is also complex. In addition to developing spike protein antibodies, the immune system also enacts B cell, which makes more antibodies, and T cells, which find and kill infected cells. This often means much less viral load, less severe infection, and reduced risk of transmission to others. The bottom line is that it's much safer and much more predictable for your immune system to learn how to protect itself through a vaccine than by catching the virus.